All right, everybody, thank you so much for those presentations. I want to, first of all, apologize to our second presenter. There was, I think, some mix-ups in the information that we were provided when we created the recording for the intro. And so you heard the bios of people that were not here today. And so I'm actually going to provide you with a quick bit of information about our second presenter. I hope I can say your last name properly. But the presenter was Dr. Celia Maya. Is that correct? Okay, great. And Celia is an experienced public health and social epidemiology scientist with a multidisciplinary research expertise in assessing the impact of socioeconomic, psychological, and behavioral conditions in the interventions at the individual, contextual, and structural levels on individuals and populations' health outcomes over their life course. She's also a postdoctoral research fellow at the MAP Center for Urban Health Solutions, St. Michael's Hospital in Toronto. And she's been working with the at-home Chez Soi study, Toronto site, which is what you heard about today in the qualitative study that was occurring there. So I again apologize to Dr. Maya and appreciate her being here and all of the information that was shared. So thank you again, everybody. It was great information, and it was information for me that created some questions, but also helped reinforce some important concepts that I think many of us have had and we feel are very strongly tied to. So I'm going to jump into the questions that were asked. Kelly Erb asked a question wanting to know what training specifically your financial support workers have or need to have. So this would be for the SHIP folks.
I can jump in there. We actually come from a wide variety of backgrounds. Some of us have had financial backgrounds, either in business courses. Most of us have a social services background with specific training, either as trustees in other organizations. Most of the new hires have been actually trustees in other organizations and just bringing those skills with us, or as independent outside of their role. They also are doing financial planning with families and bring that knowledge as well. In terms of my approach, for instance, I got a lot of training from Prosper Canada, utilize some of their tools as well as some of our other community agencies to utilize learning. We're always trying to learn and enhance what we know and share our knowledge and learn from others.
Okay, great. Thank you for that answer. Continuing on with another question around the trusteeship piece, Brian Rock is asking, or he's mentioning that it's difficult sometimes to convince clients in the program to agree to trusteeship. So he's wanting to know what tips you have, what strategies you use to help bring these folks along in the pathway to trusteeship.
That's okay, I'll jump in on that one too. That is definitely a challenge depending upon how it's set up with the trusteeship. I saw that question. I was wondering if the service is strictly trusteeship. For us, one of our tips was to create a range of service. So when we're identifying and working with individuals, we want to let them know that it's a range. So we don't necessarily go straight to trusteeship and their money is being handled by us and suddenly they don't have control. There's a lot of concern sometimes around that. And so sometimes we'll start off small. Maybe it's just, hey, let's meet and let's just chat. Let's build a bit of a rapport. Let's build some trust. Let's talk about money. Everybody has things about money that we can talk about, and start off with little bite size and work our way up to building that trust. Maybe we'll start working on a spending plan. We don't often use the word budget, and build it up that way. And then as people see some progress, or if we can hit off some goals that they have and maybe hit that off and build some trust that way, advocacy maybe with the income provider, something they see a quick win, they might build up some more rapport to then eventually say, okay, I can give a portion of my money to you, or help me get more money, or whatever the case may be. So I find that the approach that I've liked with what we do is this range of services. It's a spectrum of services. Hope that helps.
We give it time to recognizing that trust needs to be built. So we see, for example, in the programs that are closer to the experience of homelessness, the Home for Good and the youth transitional program, it might be more around financial literacy and those conversations and the skills building. And then as folks are in those the supportive housing programs, and they have had a more longstanding relationship with our organization, there's more of an uptake on the trusteeship there.
Yeah, and so part of what I'm hearing, I guess, is we're going to put your money where our mouth is, where our action is, right? So what you're saying, Earl, is we're going to show by our actions that you can rely on us, that we're there for you, and that trust factor eventually helps them to feel like comfortable with this new approach, this new idea. Yeah. Okay. Super. I actually wanted to Dr. Maya to ask you a question, because one of the things that you highlighted in your presentation came through loud and clear for me, something that we've been sort of trying to preach to Canadians forever, and that is that we can't. One of the things that came out of the original At Home Chez Soi study was that people's functionality is not capability, right? That just because the way somebody is functioning right now doesn't mean they're not capable of greater things. And that goals, people oftentimes, we shortchange people in the kind of goals that we think that they might have, when what you've highlighted is reinforcing that oftentimes these goals are very grand goals, very big goals that are based on real strong values in their lives. And so my question is where do you see, or where does it seem to be that these people are wanting to access the skills related to obtaining those goals? And I know later on you talked about with the program. And so part of that makes me wonder, how does that impact the idea of trying to build in self-determination and not having people become too dependent on the program, right? So where's the boundary between having the program providing all of these skills versus helping people get connected to those skills in other ways so that they can eventually not need the program anymore? Does that make sense?
Yeah, thank you very much. We can see this participant or people who had experience of homelessness. Sometimes, we believe that they are able to do things, or they are not capable to reach, as you say, big goals or becoming independent. So what we can see is that housing first help a lot, especially with access to housing. But I think at one point, after people become a stable house, that they can focus in develop other areas. And many of these areas is be able to provide them with the possibility to access education and develop their training, but also their life skill. And does mean that it's more a structural level than a program level, is that these people are able to access education. The majority of the people that we interview, they wanted to go back to school. I am talking about these people already that are adults, over 40 years of age, and they wanted to go to education. And some of them already had high level of education, but others just wanted to do some kind of training that made them feel not only receiving money, but feel helpful for the community, helpful for their mental health, working. And one of the things is that there is not what they say, that we know that the system didn't offer some kind of more support in access to affordable education. And even sometimes these people only are providing with access to education that actually they don't lead or doesn't lead to them to reach the skill that they need and be free of the system help. Because one of the things is they are afraid, oh, if I go part-time, I will cut in my financial aid, or I can continue to access the program. but it's not enough for them to cover whatever the job they have, to cover their basic needs outside the housing. So one of the things is just working on advocate for more access to these meaningful programs that they are actually able to access employment. But beside that, the education and employment is working with the employment opportunity, because these people face lots of barriers due to the discrimination, stigma, and many of these people we know had criminal records. So some of the things I suggest is create partnership with the education institution, with the employment institution, and other social support that these people actually are able to navigate and fully integrated after they become in a stable house. And I think this is one of the solution for helping them to become independent and use less the program. Because these people are able, these people, if they could, they will not use the social assistance.
Yeah, and I think the other thing that your information really highlighted and reinforced for me was, you know, when you say housing first is really helpful, especially in getting people access to housing. But I think what people sometimes forget is that true housing first is meant to be, like Samson Barris will say, that it's not a housing program. In fact, what he says, it's a recovery or a support program. And so those supports that you highlighted that need to come after they're housed should all be part of housing first as well. And I think a lot of places forget that there's more to their housing first model than just housing.
So something I wanted to add at that is sometimes forget that as soon as the person becoming stable housing and sometimes their mental health improve, we need to focus or be able to create new opportunities, new services that actually meet their new challenge, their new needs. Because when they become in a stable house, maybe housing is no more their priorities, but we need to be able to be more dynamic, giving them more dynamic program, and also according to their needs. And this is housing first, and actually it's not only access house, but should be more able to connect. But also we need to recognize that having housing is one of the most important ground for these people to improve and recovery. That means that also housing first program need more support, more financial support, and create more partnership with other institutions around. Yeah.
Super. Thank you for that response. I'm going to come back to the folks from SHIP. So Travis is saying, I can definitely see the benefit of a financial support worker, but I'm wondering if you have any information on engagement from clients, i.e. what percentage of clients you serve in shelter systems or supportive housing that are offered a FSW are actually accessing this service. Or of those accessing service, how many are following up after the first meeting or consultation?
Great question. And my response would be, and Earl, jump in here. It sort of varies. Again, we have a core group of financial support workers that serve multiple programs from within SHIP. With our Housing First Collaborative, I would say probably between about 15 and 20% are usually sort of actively involved with the financial support worker program. But again, it's based off of their particular needs, and they're referred through their primary case manager. So they have the opportunity to come in and out of the program based on what their goals are. But I would say it's roughly about 15 to 20%. With the youth component through the transitional and housing and aftercare program, the financial literacy is really built into the in-house programming that's offered at the transitional housing. So it would be more frequent sort of uptake there. And then it carries through to the 1 year aftercare where there's a savings component. So it's really built into that program. And then with our core supportive housing and HIP programs, it's available, and there's typically even a bit of a wait list for the 3 FSWs that are serving those programs. So there is quite a demand for it, but it varies depending on the program.
Hmm. Hmm. Okay. So I have a question from Michael that could be for both presentations, I think. He says, is it important to hire and retain support and helping workers or laborers who speak other languages, have international experiences, and are open to intersectional, intercultural sensitivity? So in any kind of support role, skills training, those kinds of things, is it important to have people who are multilingual and have international experience and multicultural experience?
Absolutely. I think that's also reflective of the population we're serving in our community. So that would certainly be a goal.
Yeah, and maybe I would like to add at that it's important that we recognize that many people who become homeless is people from other racial and cultural minorities. So many times these people experience loss of barrier to access services in their language. And also we know that they don't trust. When you was talking about trust, they need people who they trust. And we can see my participants can help in this program. Many of them wanted to be peers so that they know the experience and are able to speak other language. And I think that is great, part also of the services.
Yeah. Okay, so I have one more question that just came in. Christine is asking because they are new to this field, and because of the difficulties that there are with so many needs, and when people, when she gets new people onto her caseload, she's asking, with Housing First, is it recommended that you get them housed, then work on all of the other issues they're trying to deal with? So how would you folks answer that question?
Me?
Annie, sure. Go ahead.
So yeah, we know that. So I will be clear, the Housing First is very effective in making people become, stable housing. So that is the priority. And as soon as, and also we need to recognize that putting people who have been living outside in the streets, experiencing loss of trauma, discrimination, when they are moving to housing, it's not that the day after or the month after that are going to become, comfortable living in the new space. It's a quite long period or long process to be able to, again, be able to feel that they have the place, that they can, trust that place, that they are able to live with themselves. And then after that, for that, it's important to have some kind of personalized services focused in working in the other priorities. The other priorities is employment, mental health, physical health issue, and the social, reveal the social network and reveal the social trust, I will say. But the word employment is very important. The word and employment opportunity is very important, because we know that even when you are not homeless and you are from suffering poverty or from different minorities, you experience structural barrier to access to employee. So yeah, I will say yes, it's part of the employment, is one of the priorities that should be focused also within the Housing First program or other social programs that are helping these people.
And Catherine or Earl, did you have a response to that?
I'll jump in. As I understood the question, it was sort of what comes first. And to me, it's Housing First is always around housing, yes, but housing with the wraparound supports. So they kind of have to go like one hand and the other hand working side by side or working together, because as was well said by the doctor on the call, if you have housing without those supports, it can be almost useless, because the individual may not feel safe for a variety of reasons and may lose the housing, or it won't enhance their ability to keep the tenancy. So I think that it's definitely a hand in glove approach, that those two come together. Almost feels a bit like a trick question. They got to be together. It's the wraparound supports coming in at the same time as the housing and working in conjunction. So the more opportunity that it can be integrated, and the more opportunity that those individuals who are involved around that individualized case plan and based around the client's goals are working together, I think the better chance of success.
Yeah, and if I could, I would just add one note that there's one of the core principles of Housing First is about the separation of housing and services. And what that really means is that one should not be contingent upon the other, right? So somebody shouldn't be kept from accessing supports that they need just because they're not in housing.
Yeah.
But at the same time, somebody shouldn't be kept from accessing housing because they're not participating in particular services or supports, right? So I agree with you. It is both, the hand in glove concept, but it is also very person driven and person centered about what they want, right?
Yeah, and I will just to add that it's just the multi intersection that in this issue. And sometimes, as I think I have published an article when we analyze many of the outcomes, how they intersect, and they intersect. If you had access to house, employment, and maybe health, it's more likely that you had better trajectories of recovery. Also, substance use and trauma. So we need to be able, we should be able to see homeless as a multidimensional problem and work toward that. As and agree with her that services should be around and not wait until the person becomes a stable house and then job or the way around. It's all together, but that requires lots of specialized also support person, assistant, and also financial and partnership, strong partnerships. Otherwise, we are going to continue to see homeless people around because there is no strong support for helping them to actually become integrated. Yeah.
And it's interesting, Elizabeth just added something in the chat where they said, from a lived experience person, I believe that recovery programs such as you're speaking of should begin in an emergency shelter to a transition house and supportive housing, and then on to private housing all the way through, because it takes so much time to rebuild once at rock bottom. And the interesting thing about this is that even though we've just said what we said, I also agree with that. And the reason I say I agree with that, and I'd be curious to know any of your thoughts, is that that's where choice comes in. And that if an individual who is, seeking to move from the streets or wherever they're moving from, if that's a route that feels better to them, then that's the route we should support them with. Does that make sense to you folks on the panel?
Absolutely.
Yeah, definitely. And not only as for homeless, but for example, people who live in incarceration. So these people, when they are in this situation, should be connected. So for example, if they access to shelter or access to social information center, this kind of information should be somehow integrated, and people should be referred appropriately to access as soon as is possible. Because actually the truth is, sometimes people say there is lots of support out. But the problem is people don't know how access this support, don't know how navigate. Remember that many of these people don't have access to internet. They don't have a fixed address. And there is this kind of more structural barrier. If you don't have the address, you can have ID, or you can have, the number, or you can apply for a job or for a system. So I believe that an integrated system, also information system or referral system, should be implemented if that is possible.
Yeah, like Housing First kind of has taken a beating in some ways about transitional housing, but what we're really saying is that transitional housing shouldn't be something we mandate for people, that we tell them this is what you have to do, right? But as an option, that's a whole different story when it's part of the person's choice. So thank you guys. You've provided some great insight, and you've obviously tweaked the interest of people, around various things, and given people lots of things to think about. So, I appreciate the time and energy you put into your presentations and your thoughtful your answers to the questions and things. I also want to thank everybody that was listening for your questions and for the time you gave to these presenters. So thank you, everybody. Enjoy the ending of the conference. I hope it's been good. please remember to do the evaluation, click on the evaluation link and give us some good feedback there, or whatever, honest feedback. And it's all helpful. So thanks again for attending, and we'll see everyone hopefully real soon sometime.
Thank you.
Thank you.
Take care.